Have you ever noticed your breathing making an unusual sound, something beyond a normal sigh or gentle breath? Sometimes your body gives you little clues about what is happening inside, and listening to those sounds can be really helpful. Exactly, wheezing is a high-pitched whistling sound produced when air moves through narrowed or constricted airways. Imagine trying to blow air through a very narrow straw. That is the kind of sound a wheeze makes, but originating from your chest as you breathe. This distinct whistling sound happens because your airways, the tubes that carry air to and from your lungs, become tighter and smaller than usual. When air tries to squeeze through these narrowed passages, it creates turbulence, which then generates that characteristic musical sound. It is often a sign of conditions like asthma, allergies, or chronic obstructive pulmonary disease, also known as COPD, where inflammation or muscle spasms can tighten your airways. You might hear wheezing more prominently when you breathe out, which is called expiratory wheezing. This often indicates a mild to moderate airway narrowing. If you hear it both when you breathe in and breathe out, known as inspiratory and expiratory wheezing, it could mean the narrowing is more significant. Sometimes, people even feel a tightness in their chest along with the sound. Recognizing this sound is your first step. Often, you can hear wheezing without a stethoscope, especially if it is loud. Just listen carefully to your breath. If you or someone you are with starts wheezing unexpectedly, especially if it is accompanied by shortness of breath, it is always a good idea to contact a healthcare professional right away. They can accurately assess your breathing and determine the best course of action. It is fascinating how a simple sound can tell us so much. Sometimes, a person's airways can be so severely constricted that there is not enough air movement to even produce a wheeze. This is known as a silent chest, and it can actually be a sign of a very serious problem requiring immediate medical attention. Your healthcare provider, using a stethoscope, can also distinguish between different types of wheezing sounds, such as monophonic, which means one clear pitch, or polyphonic, meaning multiple pitches, giving them more clues about your lung condition. Understanding what wheezing sounds like helps you become a more informed advocate for your own lung health. Paying attention to these subtle signals from your body and knowing when to seek professional advice is a powerful way to manage your respiratory well-being and stay on top of any changes.